be talking about bone chips removal in horses. So I chose this topic because 2 summers ago I had the opportunity of shadowing an equine veterinarian back home, and he mainly worked with racehorses. And a little fun fact is that informal horse races have been taking place in Puerto Rico since the 16th century, and it's been a formal sport for 136 years. So bone chips, they are osteochondral, osteo meaning bone, and chondral meaning cartilage, fragments or pieces of cartilage covered bone that have been chipped off into a joint. It is very common in athletic horses, and they range in size. They can be as small as flakes or pebbles, or they can be just chunks of bone. Although it is a fracture, it does not necessarily mean it will be a career or life-threatening if it is treated properly.
And are you going to point out the chip in this
Yes.
radiograph?
I will go into more detail in the next few slides, but that is just kind of a general view of how the bone chip looks like. Then for causes, it is very, the carpus or the knee and fetlock joints are the most susceptible to these bone chips. Over here we have the carpal joints up here, and then down here is the fetlock joint. It is due to repeated weight bearing on a small surface area and high amounts of motion. It is a site of, also it's a site of stress, and that just weakens the underlying bone. And then there are 3 ways that bones can fracture. So momentary loading of bone fracture beyond its strength, that can cause acute trauma, including due to getting kicked or striking an object or just simply falling down. And then there are pathological fractures that are caused by bone weakness due to infection, neoplasia, which is tumors, osteoporosis, and or other bone diseases. And then lastly, the fatigue fractures are just accumulation of micro damage, and that one is the most common in racehorses. Some clinical signs, so sudden onset of heat, that can just be sweating and also a rapid heartbeat. It will also cause pain and discomfort, and you will, as you will see in a few seconds, it will affect how the horse trots or runs. And then there is going to be fluid accumulation within the affected joint, and then some lameness. So let me just show you. So first, diagnosis. You, the vet usually does a physical and a lameness exam, and then after that, just take some X-rays. You will want to take some X-rays from various angles because it is very important to adequately determine the size, the shape, and the exact location of the bone chips. And then over here, I'm going to show you a video of what a physical and lameness exam looks like. So you will want to pay attention to the left hind leg. The horse is going to be engaging it less, and then I'll kind of walk you guys through it.
Is sound important?
Not really.
Okay.
Just look at the left hind leg in a few seconds. And then over here, it's if you guys see, it's kind of limping there at the beginning, and then with the left hind leg, it's a bit more noticeable. Here at the start. He's not putting very much weight on it, and then it is also interesting to see that they perform this examination in different surfaces, and then just be very attentive to how
Still felt good enough to buck, huh?
to how they're stepping on there. So yes, as I said, the most common are physical and lameness exams and radiographic imaging, and there are also other options such as ultrasonography, MRI, CT, bone scanning, and thermography, but those are not as common. And then for treatment, you want to determine whether the horse can live with the bone chip or if it's better to just remove it. And things to consider are Most horses can tolerate some fractures in the top or radiocarpal joint. Chip fractures in the lower joint of the knee will remain a constant problem. Pleasure horses with chips that have been present for some time and have no evidence of active degenerative joint disease often do not require surgery. And then chip fractures at the proximal and dorsal part of the first phalanx, I think that's how you pronounce it, do not necessarily cause lameness. So just a general rule of thumb, higher athletic levels means that those joints will be less tolerant. So there are two options, conservative options. That's when you determine that the bone chips are not really a big problem and you choose to ignore it. You can treat that with nutritional joint supplements or just chondroprotective medications to enhance that joint health. Then if you opt for surgery, the horse will undergo general anesthesia and an arthroscopic surgery. It involves making 2 small incisions into the joint, one for the endoscopic camera and one for the surgical instruments. And there are various benefits. The most important one is that it causes less trauma than an arthrotomy, where you just make an incision and you cut through that joint. And they are currently working on ways to perform orthopedic surgeries in the sedated standing horse. The reasons for that is that, let me see. I want to be very specific. You want to avoid complications after undergoing general anesthesia, and also that heavily lowers the cost and also the procedure length. So these are pictures of the surgery. I got to shadow 2 of the surgeries, and that is just general placement and setup. Then over here, the vet is just inserting the endoscopic camera in through one of the incisions. Then over here is the monitor where he can kind of locate them, and then through the other, you can't really see it in the picture, but through the other incision, he's just pulling those bone chips out, and those are the ones that they removed that day.
So that was like from one joint or one leg?
Yes, that was just one knee.
Yeah. Did they do the other one, or?
No, that
So it
was
was just one side?
Yeah. Then for prognosis, the recovery takes about 3 to 4 months, and then the horse can return to its previous level of performance, and usually recovery is pretty good, no complications. But if surgery is not performed, chips can remain in the joint and attach to the bone or soft tissue, and it can even irritate the joint and cause inflammation or degrade the articular cartilage. Chronic inflammation may lead to degenerative joint disease or osteoarthritis, and then that would just mean that you will have to, the horse will have to require management with anti-inflammatory drugs and nutritional supplement for that osteoarthritis for the rest of its life. And those are my sources.
Questions, comments on bone chips? That, I'll say if it's not one thing, it's the other, right? Did I get you?
Can you go back to the photo of the actual surgery? So,
This
just out of
one?
curiosity, how big are those bone chips?
Oh.
Like, are those all like a centimeter long or so, or
They are very small. I would say, about a centimeter.
about a centimeter?
Yeah,
Thank you.
but they vary in size.
Yeah.
Those
Yeah.
were the ones that I got to see, but
I just
apparently
wanted-
they can be bigger.
Is that so? That wouldn't be a severe case; it'd be rather minor.
Yes, that would be
Okay.
better.
Now the thing, Ethan makes a good point. Whenever you take pictures of things, to use this for the rest of your life, try to have something like a ruler or a penny or a quarter for reference. That's what I always try to do, like, try to find a quarter if I'm gonna take a picture of a uterus or something.
Mhm.
Because sometimes, depends on the magnification, you can kind of see that drape. Some of us know what size that looks like and all that, but that's great. Other comments, questions? Is it mostly the back leg then for bone chips? Do you know a percent back versus forward?
I am not entirely sure. The one that I got to see was actually the front leg.
Oh, front, okay, yeah, so it must be front. What's the percent of the horse's weight that is on the front 2 legs? The percent of the weight. So then I could also ask, what's the percent of the weight on the rear legs? If you have a 1,000-pound horse, how many pounds on the front? If you had a scale, you could weigh that, right? And on the back. Anybody?
about 60 to 65% of the time.
Remember, 60% on the front. It's like, why? The back legs are bigger. Should there be more weight on the back? No, it's 60-40. Not 50-50. 50-50 would even be better. That's just 60-40. Okay, we're gonna move on. Thea, did you have a plug-in or something? Okay, great.
You don't need to
Valeria?
down silent, please.
Yeah. Thank you so much.
You can just-
Appreciate it. Yeah, horses are something else.